Bruno Gomes is a psychologist with a master's degree in public health at Sao Paulo University and is doing research on ayahuasca for drug dependence and with homeless people. He has been working with Ibogaine treatment since 2010 and is also collaborating with Icaro Unicamp's ayahuasca research to treat alcohol dependence. Bruno Gomes.
Hello, everybody. Good afternoon. My name is Bruno, another Bruno here. And I'm also Brazilian, and I work with the other Bruno, but I'm psychologist and he's the doctor. And so it's good that I'm talking here with him after him because he did all these explanations, more technical explanations, I can say. And I will talk more differently from the other presentations in this conference. I will focus more on the how the treatments are happening in Brazil, and a little bit how those treatments, what sense does those treatments makes for the patients. What are those processes for the patients? How are the outcomes, and how do we deal with all that? And also I will compare a little bit with ayahuasca processes also because I've been studying these two substances in the last years. So as I said, I'm a psychologist, and before I started working with ayahuasca, I used to work with crack cocaine users on the street for like 10 years. And then I did my master degree doing like an ethnography with a group using ayahuasca to recover homeless people and drug users. And nowadays, for the last 8 years around that, I've been working with Bruno, doing the the psychotherapeutic treatment. So we've been working with mostly crack cocaine users and alcohol problematic users. Because in Brazil we don't have like opioids. I don't know if it's good or not this, but we don't have opioids over there. And so it's like a little bit different the processes from those opioid users, because we don't have like all those strong withdrawal issues, but we have other very difficult issues also. And so I will talk a little bit about that. And so in the end, I will compare a little bit with those processes with ayahuasca. Okay, so for anything, I would like to thank MAPS and Bialabach and everyone who is organizing this and he invited me to talk about that. And for me, it was important to think about presenting on the how the things are happening, because usually we read a lot about ayahuasca and ibogaine, all those promising effects, like it's the cure for a lot of things. Some people almost think it's like a new panacea that can cure depression and PTSD, drug dependence, and in a lot of other things. And when you start to get closer to it, you see that's like a little bit complex, those processes. Not like people just take ibogaine and everything's like solved, you know. And for most of the patients, they usually think it's like that. So a lot of people, so we will work with a single dose of ibogaine. We have those screening tests, and people have to stay 30 days in abstinence of most substances and a few medical medicines. And we've been working with those patients, and usually people and I see people 4 times. We have 4 meetings, psychotherapy meetings, before they take ibogaine, and usually they see me as like an obstacle to get to ibogaine. They don't really want to have the process and to talk to me, explain their lives and etc. Usually we get a lot of patients that are a little bit tired of trying many treatments, AA, NA, and clinics and therapeutic communities, and they have seen a lot of psychotherapeutes and psychiatrists, good ones, bad ones. They're a little bit tired, and I'm just like another one, and they don't want to see me. They want to have Ibogaine. And we really try to explain to people that it's not like this magical pill that will solve anything. Like magically, sometimes it's like magic, but sometimes we can't just like bet on this part. We try to create. I guess we work on like the preparation of the set, the person, so the person can like take the best of the Ibogaine effects. So, and usually people, when they see Ibogaine as this new medicine pill that will take the craving out of me, that I will have no withdrawal, it seems that will solve everything related to drug dependence by itself. So part of the work that we have to do is like deconstruct this understanding. And also we have to deconstruct a little bit of the expectations that people have on the Ibogaine. Because usually people that think that, oh, if Ibogaine will quit craving from me, will solve everything for me, what do I have to do more anything? It's just like keep living my life in the same way that I've been living, but without the drugs. So sometimes it seems to be very easy, and we try to put this Ibogaine experience inside of a process, because we notice that it's not like just taking Ibogaine to get cured, and people have to get the best of those effects. Which effects do we've been noticing with the patient? So usually we have like very strong effects during the 24 hours that the person stay in the hospital. We work with just 1 day inside the hospital. We ask for 30 days of abstinence, and then the person goes to Bruno City, the hospital over there, and then take Ibogaine. We do like a test to see if there's drug in the body and etc. And then after in these 24 hours, they have like strong effects. They feel like dizzy. It's easy to vomit and etc. Usually they feel like a very intense flow of thoughts. So it's like people say it almost doesn't seem that it's not my thoughts. It's like something. Sometimes it's there are thoughts that are passing through my mind. People talk about a lot of memories and about their life moments, very significative moments that are meaningful for them, or sometimes moments that they don't really understand why they remembered it. And also, people have a lot of visions and dreams, a little bit like an awakened dream. It's something like this, and people see like a lot of things. The people that died, like parents that have died, they see things that have like a lot of meaning too. Like, oh, I understood the sense of life. Understood why everything's like that. I understood why I started using crack, and then it made me understand why I have to stop it. And sometimes people see a lot of crazy shit that they don't understand anything also. So it's not it's very interesting because the effects from Ibogaine, they are really like we need a very safe setting, a very protected environment. We have all this preparation, and we work with, as I said, in a hospital. It's not like a setting with music or it's like walls. They are all white. So it's a really real a biomedical setting, very traditional Occidental, and so and it's different from the ayahuasca settings usually. But there are many patients that when they see me afterwards, they say, "Oh, I saw the spirit of the iboga, and this spirit came and talked to me. Usually an old woman, and so it's very interesting because the setting, like, it's very important, but it's not like decisive on what's gonna happen. So there are many people that comes to take ayahuasca and take ibogaine, and like they are really expecting for like this new medicine pill that will take the dependence from me. And there's like this side effect that it's like some kind of visions that I may have. And so there are people that don't have like this expectation of an spiritual experience. They really they see those visions as just a side effect. I even receive people that say, "Oh, I will accept giving Ibogaine to my son if this is like a medicine pill. If this is something like mystic or from those tribes, I would not accept that, you know." But there are many people that goes to the ritual, to the Ibogaine treatment, and after that they say, "Oh, I had like a very spiritual experience. I saw something. I met God," and so it's very interesting because it's all those things. They are not like in this setting, you know. There's nothing there that's like suggesting anything for this kind of experience, right? So during the 24 hours over there, people have those kind of effects, and it's very important, as Bruno was saying before in this last presentation. There are many patients that oh, I heard that my friend took Ibogaine and he saw his grandfather, and so that means that Ibogaine worked for him. And if I don't see a deceased parent, maybe it seems that Ibogaine is not working for me. So usually it's very important to like prepare this expectation from the patient, because there are patients that they expect to see something. If they don't see something that they thought on their heads, that means for them that the Ibogaine is not working, and then I will relapse. And sometimes you see on their eyes that Ibogaine is really working. They have these, you know, shiny eyes after that, and even feeling this no craving, etc. Some people relapse because they didn't saw what they wanted to see, and so that means, so it's very important to there are the those intense effects, but also how those effects are interpreted by the patient, but how he understands what's happened to him and how will him deal with it. Because we see after the Ibogaine experience, like after those 24 hours, people usually get a little bit like they're tired. You know, it's very intense when you have Ibogaine. But after when you rest a little bit, people start to feel like with no craving. There's no symptoms of withdrawal, and also they have a very clear mind. Many patients, they tell me, you know, now I understand. My mother's crazy. I have to do something like this. I have to work. Life is very simple. So usually it's very easier to focus on your life, to take care of what you need to take care of, and deal with the problems on the life. But there are many people that are so, and how those effects can really have like a impact, like a lasting impact on their lives. Because there are many patients that we treat also that they have Ibogaine and they feel, you know, very well. They don't feel no craving and etc. But you know, after 6 months, they start to live in the same way that they were living before Ibogaine again. You know, because it's like sometimes I compare like you know, people with well, that go to a spa to get thin. You go to a place and you stop eating, and then you get thinner, you get better, and then you go back to your daily life, and little by little you go back to your ancient daily life when you start to eat more and eat more something, more ice cream, more chocolate, and etc. And usually I see those problems with the crack users a little bit in the same way. After Ibogaine, they feel very well and they feel fine. And sometimes for them it's like, oh, then it's cured, right? I'm feeling okay. I feel no craving. I just keep on living. But usually the problems with the drug dependence, they are not really associated with the drug. You know, they are associated with the person's life. You know, how he's like satisfied or not with his life, if he's happy, if he's enjoying, if his life makes sense for him. So there are many people, they like take Ibogaine, they continue on their lives, but their lives have the same problems that have always had, and they don't know what to do with that. And so after a few months, there are people that go back to the same problems in the same way that they were dealing, like using drugs and having problems with that, and etc. So I see that there are like the effects that the people have with Ibogaine, and they are usually like very impressive. But so that can have like a lasting outcome that people can really feel like the way that they hear about Ibogaine, that will have a single dose and they will be like cured from the drug dependence and etc. They have to really put an effort on their lives, and to focus and to try to understand what's happening. And so many people, they got really lost after that. You have Ibogaine and you're feeling okay, but at the same time, sometimes you know what you have to do. I have like I do my marriage is finished. I have to leave. I have to live by myself, or I have to find another job. Sometimes people can identify what's really all the problems that they are having, but it's hard also to really change the problems, to change and to overcome the things that are happening. So sometimes people, they can identify, but they don't know what to do, and they sometimes come back to their life again and again. So I guess it's very important to see the processes with Ibogaine as processes. Like it's like a substance that will change something, but will, if use it in a good moment, in a specific moment, may really help the person to overcome very chronic problems sometimes. And so in Brazil, sometimes we have been using for some patients also, and for those that it makes sense for them, to like make a follow-up with ayahuasca, for example. There are so I make like 4 psychotherapy sessions before Ibogaine and 4 psychotherapy sessions after Ibogaine, and with that we try to build like a planning on how to continue of taking care of himself for each patient. Because we see this part of this neuroplasticity that those substances have been helping to promote. But if the person don't like stimulate and don't have like any activity, sometimes there are no big changes. So usually it's good if the person can be more implicated in activities that make sense for them, that will make them feel better and will make them deal with their stress, with their daily problems, and etc. And so we try to build this kind of thing. And for many patients, we have like this kind of follow-up that they do afterwards with ayahuasca, with ayahuasca sessions. In Brazil, we have like a very positive regulation on ayahuasca. We have like a religious permission to use ayahuasca. So, but you can say that many things are religious, right? So we have a very big diversity on rituals with ayahuasca in Brazil. In São Paulo, where I live, I've seen like Buddhist ayahuasca rituals, Hinduist ayahuasca rituals, Christian. I've never seen Islamic or like Protestant, but almost all the others I've seen. So it's good because it's easy for the person to find a ritual that makes a lot of sense for him. There are patients that they are very connected with Afro-Brazilian rituals that have like this mediumship, etc. And for them, it will make sense this kind of thing. There are others that they don't want to hear about religion or any sort of this kind of thing. So they can go like to a Buddhist. It's more like philosophy and etc. And so with that, we can build like a kind of follow-up with another substance that sometimes has a close experience, like they have many differences, but they have like a close effects, like ayahuasca and ibogaine. And for many patients, it's very good to have a follow-up with ayahuasca. Usually ayahuasca, we will think with, it's not a single dose, of course. Usually ayahuasca, we have like a periodic session, sometimes once a month, sometimes twice a month, sometimes depends, you can propose something to the patient, depends on his specific situation. Well, my time is almost finishing, and now I would like to open for like questions, and so we can debate a little bit.
How safe is it to use ayahuasca after ibogaine? When I did ibogaine once, it warned me about ayahuasca, so I was just wondering how safe is ayahuasca in conjunction with ibogaine?
Well, we don't use like in the same day, of course. Usually, people we have this all this strict and long preparation for the use of ibogaine, and usually people will use ayahuasca only after 2 or 3 months after taking ibogaine. So I guess it's a safe period of time between one and another.
Hi, Bruno.
Hi.
I have a question regarding the visions, the imagery that may appear in the ayahuasca experience and the ibogaine experience. How, in your, I know you don't have numbers for that, but in your clinical experience, what do you think about the importance of what is seen in the visions in the ayahuasca experience and the ibogaine experience with regards of the results of drug dependence, the outcomes?
That's an interesting question because they have many visual experiences with ibogaine. The people report different experiences. Usually, I don't know. Ibogaine usually they report more things related to their past and to sometimes to parents and etc. That doesn't come that often with ayahuasca. And one interesting thing is that with ibogaine, the visual experience doesn't seem to be associated with those positive outcomes of being abstinent. Because usually there are patients that, and there was a paper this year that suggested a little bit this with an online survey. And so there are patients that have a very intense and meaningful visual experience. They have like something very intense, but and the outcome doesn't necessarily is good regarding drug use. Sometimes people relapse, but there are people that has no visual experience, no hallucination or vision or wake and dream, but they can feel very well afterwards. You know, this kind of afterglow that people feel after. It doesn't seem to be associated with the visions that people have. I don't know. It's something to be better studied.
Hi, thanks for the presentation. Very interesting. Could you tell us if there's much in the way of aftercare that you do with your patients once they've been treated with ibogaine?
So for us, it's very important to have this pre-care, you know, to have this preparation, so we can have like a good connection. Like I have to be very, the patient have to feel like familiar with me and with Bruno, so he can trust us, and this has to be built up before. So since when this is like built, we usually I see them once a week for the next month after ibogaine, and we have this follow-up trying to identify what he's feeling, try to help him understand what he experienced with ibogaine, so a little bit of integration, and also to understand what's he's feeling, after, in the weeks after Ibogaine, because some people feel, oh, I don't want to drink Coca-Cola anymore. Is this an Ibogaine effect or not? You know, people start to try to identify what's happening, and so there are many different things that people identify. And if we notice that the person is having like a more difficult problem to organize in daily life, we try to be more closer and sometimes to send him to a psychiatrist to help him feel better.
Hey man, nice shirt at first, and thank you for the presentation. My question is a little bit similar to the one before, like how can we help people to stay in their beliefs, or like what they learned out of an Ibogaine experience, like especially for people who got rid of addiction, like that they're not going back in their old habits. Like, you think microdosing after a while would be good for them, or how? Thank you.
Yeah, I think that we have many different possibilities, and I guess for those possibilities to be to make a difference for the person, it has to make sense for him. So usually, I had patients that started to do microdosing with mushrooms, for example, and but I try to identify what makes sense for the person. Sometimes, like ayahuasca rituals, sometimes go to their the churches where they believe. I had like patients that used to be like a biker expert to do bike all around the country, and that made a lot of sense to him. And so I guess it's very important to identify what's meaningful for the person, what helps him de-stress on his daily life, what helps him to feel less impotent against the daily problems, and etc. That's what I think.
Thanks, Bruno. You mentioned that there are differences between the stimulant users that you treat and opioid users in other situations, but I'm not sure that you really expanded on that very much. Can you remind us what the minimum time between last use of drug of choice and the treatment would be, and specifically whether you've had any particular issues with stimulant-induced psychosis or perhaps sleep-induced psychosis? Thanks.
Okay. So we ask for people to stay 30 days abstinent from crack, cocaine, alcohol, and a few antipsychotics, antidepressants. We usually don't have many problems. I can notice that even when people have like a psychotic, I don't know, the paranoias and things like this that are like closely related with the effects of crack and cocaine. Usually it's not like dangerous to have Ibogaine, because usually when they have like those kind of hallucinations, but this wear off when the cocaine effect goes off, also it's not like very dangerous. But we have like a very strict screening. We try to be very close to the people and try to identify any danger. So we usually deny people if we see that's dangerous for them. And the difference with opioid, I guess that these strong withdrawal symptoms that the opioid patients have, it's one very big, very important issue. And since we don't have this kind of thing with crack cocaine patients, we have to prepare them in a different way, but also usually the craving that the people have for crack and cocaine comes in a very unexpected moment sometimes. So it's not very easy to prepare for the person to deal with that, so we have to take much more attention with that part.
Do you know of any clinical trials using Ibogaine in a microdosing sort of course treatment?
I don't know. As I know, there's none until now. There are people working with small doses with Ibogaine, but all experimentally, I guess.
I'm curious about the how you work with people around setting intention before they undergo a journey or a treatment process, and if you think it matters the intention that they enter that time with.
Yeah, it's very interesting, this part of the intention and the expectations, because it's very expensive treatment. People will have to stay 30 days without using drugs, and all they hear about Ibogaine, it's usually very impressive. So it's very, it's people has to have a very big expectation. It's very normal, this, but sometimes people expect the patient expect to be like a Superman after Ibogaine, or sometimes his parents thinks that he'll stop like listening to rock music, or will go to the church with them after Ibogaine. So sometimes the expectations are so different from what Ibogaine may bring to people, that will have like, they will be very sad after that, frustrated, and that's bad, but because that reduces the implication that the person has with his own treatment. If he thinks, oh, it is failing, it's not working, he will take less care of himself, I guess. So I try to discuss with the person what's expecting, why he's looking for Ibogaine, what if Ibogaine doesn't bring what he expects. Sometimes, people take Ibogaine for one reason, and he sees that for other things are better on his life, but not what he was expecting, So I have to make him think a lot about that and be like prepared for what comes, and not like expecting one specific thing. Well, that's it. Thank you.